Hi, Javier. Yeah, so to talk about your cholesterol, depends on what kind of cholesterol you're talking about. If you talk about total cholesterol does not have a high risk factor at all. If you talk about LDL cholesterol, the so-called bad cholesterol, it's got a 1.6 risk factor for heart disease. So, but if your total cholesterol is too high, then total cholesterol is not a factor at all anymore. It's very old information. If you have high triglycerides, which is also a cholesterol component that goes up if you eat too many carbohydrates, that has got a 2.1 risk factor. But that we are eliminating with the carnivore diet. So with the carnivore diet, you can expect to get lower triglycerides and get a slightly higher LDL. But as I said, it's got only a 1.6 risk factor. It is a risk factor, but it's a very low risk factor. Other things like hypertension has a 4.5 risk factor. But the hypertension that you were talking about, 140, is not that high. Dr. Barry say anything 230 is acceptable nowadays, not only 120. So if you have 130 over 80, it's fine. But like you said, you've got 140, so you can improve it a little bit. Yes, salt can absolutely influence your blood pressure. And there are many other factors that can work on your blood pressure as well. Insulin resistance is one, because insulin resistance upregulates your salt retention on your kidneys. So yes, so maybe you can still be more stricter with your carnivore diet and look at exactly if you are maybe adding some carbs here and there to cut it out as well. Because even the little bit of sugary sauces, for instance, or a little bit of sugar, sweet taste, can take you out of ketosis. So you absolutely want to avoid those kinds of things. But yes, absolutely, you can cut out salt a bit. Do an experiment for yourself. I've done it. Go on a low salt diet, maybe a zero salt diet for a few days. It will do you good. I've done it for 3 weeks, I think, or longer than that even, I think 3 months. But then I started to add it back. But yes, absolutely, it can be beneficial. I've got videos about that as well. I've got videos about the cholesterol as well. I'll mention it here in the description on the frequently asked question playlist on my YouTube.